Hi everyone, I'm Barkha Dutt and you're watching The Mojo Story, our independent digital platform that does a deep dive into the big issues of the day. On the program today, India's vaccination drive and a very peculiar problem. Many of our health workers, though entitled to the vaccine, are actually not showing up for it. At the same time, the private sector is urging the government to allow them in if India is to meet its vaccination target of 300 million people by July. Now, at the moment, we stand a little over 9 million people who've received their first dose of vaccination. But vaccine hesitancy remains a real problem in the country, with 8 states actually reporting less than 50% of beneficiaries who have got vaccinated. Why is the private sector being let out? What should happen to all these vaccines and vials that are not being used? Imagine at a time like this that we're actually possibly having vaccines go waste. Is it time to let the private sector in, and how do we understand the government's hesitation? Let's introduce 3 very eminent guests on the program today. I'll bring them up one by one. We have on the program, welcome Dr. Harsh Mahajan, who is, of course, a leading radiologist, but also runs the Mahajan laboratories and has also been running COVID tests in this time of the pandemic. Welcome, Harsh. We're also joined by Professor Chauhan, one of our finest scientific minds in the country, and has spent his life studying vaccines. Welcome, Dr. Chauhan. And Dr. Swapnil Parikh, author of one of the earliest books on the coronavirus pandemic in this country, also with the Kasturba Hospital in Mumbai. Welcome to all of you. And we will be joined by other voices in the program as we go along. I want to start with you, Professor Chauhan, if I may. And before you actually speak, if we can bring up the numbers of what the data looks like, this would probably shock a number of people who want the vaccine but actually can't get it. Now, this is data as of 15th of Feb. 8.41 million Indians had been vaccinated till the 15th of February. This data compiled by India Spend. And if you break this down and see how much it falls short of the target, India's target number is 250 million vaccinations by July. Now, what percentage, therefore, has been vaccinated? That number would startle you, and it isn't because the vaccines aren't available. So if you take a look at the next slide, India has vaccinated only 3.4% of its target number. Just 3.4% of the target that we have set for ourselves to finish by the end of July. Now, if you look at these numbers, you basically know that India has 150 days to vaccinate 241 million people if it is to meet its target. In other words, can the country do this without the private sector? We saw the same kind of laggard start when it came to testing. At the moment, India is 4th in vaccinations globally. Professor Chauhan, let me bring you in right away. Can this be done without the private sector? And why do you think the government is hesitating to bring the private sector in?
So these numbers, which are really arithmetic, so I'll just take 1 minute. Before the vaccination began in the country, in fact, as we've discussed on your channel also, your platform also, there was some hesitation whether vaccines are safe or not. So initial hiccups. And I had said that glitches will be there and glitches were to be expected. Further glitches will be there and our job will be to fill the glitches. That said, one could argue that we've immunized very large number of people very quickly, but one could easily argue the target that we set us against. We need to do 1.45 or 1.3 million immunization per day, as your arithmetic is suggesting. Now, the question is, immediately we jump to the question whether we can do it without the private sector. Now, so there could be multiple answers. I heard government representative yesterday saying that right now we have 10,000 centers where vaccinations can be done, but we can easily increase to 30,000. So 3 times the current. This is yesterday's government statements.
Yeah.
Also, one hears that there is a sufficient number of vaccines. It's just that we are unable to put jabs into people's arm. Mm-hmm. You layer that with the narrative that a lot of people are simply not showing up. Yeah. So even the health worker, you would imagine the easiest people to get queuing up and getting vaccinated would be your health worker, because they are the ones who know about vaccines. They every day deal with patients. They are more exposed. etc., etc. So I think there's a multiple layered problem. Private sector taking help from private sector does not and should not necessarily mean privatization per se. I think there's
explain the difference between the two. Explain the difference.
See, privatization would mean that who's manufacturing vaccine should centrally they be taken. I would imagine something which is an emergency approval, still an emergency approval, not freely licensed vaccine. These vaccines need to be watched for a very long time, not for a month or 2 or 6 months. We have many questions about the vaccine which are still unanswered. There are a lot of questions. So I think we need to be very watchful. That said, the private sector in India is extremely high quality, but there are qualities and qualities within the private sector. So this would require serious planning. Should all over the world, European Union, UK, Brazil, Israel, all vaccines still today have been taken up by the governments directly from the manufacturer.
So let me ask you simply, I understand that there are complexities and there is a difference between private sector and privatization. Are you in favor of roping in the private sector at this stage, given these numbers, yes or no?
Oh, absolutely, yes. But you need to figure out, and this should be figured out transparently. You know, one of the reasons, if you go early back, look at how to get people to get vaccinated. One is you talk to them every day, be very transparent, talk to them very carefully. But also is that these vaccines are promised to the population free of cost. This is a public health problem. It is not my personal problem, should I be vaccinated. So if vaccine is suddenly going to cost very large amounts, so you will have a fraction of people going and getting the vaccines. A very large number of people will not be vaccinated. So I think we have to tread on this but I'm in favor of anybody assisting with very good quality, clarity, huge transparency.
Okay, let me bring in Dr. Mahajan on how that might play out. Dr. Mahajan, we saw the same hesitation in government when the RT-PCR tests first came in, and then they couldn't do it without the private sector. But there was even then a dispute over costing. In fact, many of the private sector players, including yourselves, then appealed to the court. There was a capping of prices. There could be some hesitation in government that the same sort of drama conflict might play out again if the private sector were to be deployed, because the government is currently paying for everybody's vaccines. Now, the private sector is obviously not going to agree to do this for free, even if you do it at cost. So, one, why is the private sector urgently needed? Even the CII is urging the government get the private sector in. And two, how would it actually work?
See, Barkha, I don't think the government was hesitant even at the time of testing. It is just that in the initial months, one just didn't know. This was a new virus that came in a pandemic form. But once, the private sector and the government, through the ICMR, through the Health Ministry, through Niti Aayog got together, things worked very well. From a few hundred tests that were possible in March, we are now, up to 1.6 million tests a day that this country is capable of. The same thing happened with the treatment. And in fact, some of the top, politicians, ministers, even, the top healthcare workers in the government, when they needed treatment, they came to the private sector. So I would say there is some degree of gap in the trust that exists. But thankfully, the one good that has come out of this pandemic is that the private and the government sector have worked closely, hand in hand. And that's why we are at this, very fortunate situation in the pandemic where the numbers are very less and vaccination is started. Now, there is no doubt that without the private sector, you cannot achieve the targets that the government has set for itself. It's just not possible. The government doesn't have the machinery, and they realize it. It's not that they don't realize it. We've been interacting from the forum of Nat Health, FICCI, with the government. We've presented a strategy paper to the government as early as December, even before, and this is with the ENY and FICCI. That paper was presented to the government in December, much before the vaccination actually started. So it is inevitable that the private sector has to get involved, and the private sector has also made clear
And
very
what would happen to
clearly.
the and what would happen, Harsh, to the costing? I just want to understand what
Yes,
would happen to
yes,
the
that is what
costing.
we made very clear to the government, that we do not want to make a profit on this. Let the government supply the vials. We will follow the list that is put out by the government on the COVID app.
Yeah.
It is just that we'll be able to immunize many, many more than what is possible today. But again, I would say, we have currently vaccines which are in stock, which have been manufactured over the last few months, nearly 55 million, I believe, which are lying waiting to be
Be
dispensed.
used. Be
but
used.
but
Yeah.
let me just conclude by saying that we cannot have a situation where we go ahead and vaccinate, because this is two doses, that we
Yeah.
go and frantically vaccinate all that is available, and then we end up with a shortage later on. So it
Yeah.
has to be measured, it has to be done in a very systematic manner. But to answer your question, there is really no way that the government can do it on its own. It knows that, and it is talking to the private sector, but currently we don't know where we are going.
Yeah. So let me bring in Dr. Swapnil Parikh. I'm also welcoming to the program now Dr. Vineeta Bal, and I'll come to her in a moment. Swapnil, you've been also arguing passionately in favor of getting the private sector involved. Harsh makes it clear this is not a profit-making intervention. Veer Chauhan is wanting a distinction drawn between using private players and privatization of the vaccine program. Vaccine equity is a major concern. But on the other hand, the data which I showed you on your screen, 43% of our health workers have not shown up for the second dose. The major hesitancy that we're seeing are actually in the frontline workers, which means that vials are being opened and they're going waste. Right? In some cases, that vial is not getting fully even utilized. Why would these spare, imagine we're a country that's talking about spare vaccinations, not be released into the market for anyone to use, or for, let's say, the next category is going to be those above 50, however the government wants to define it. Swapnil.
Barkha, thanks for having me on. I actually think it's very disturbing that young healthcare workers who are not necessarily on the front lines, they're just healthcare workers, but they're not necessarily on the front line, are being prioritized above the elderly and those with comorbidities, because that's really the age group that's most at risk for severe outcomes. And yeah, like you said, people who don't show up, relegate them to the back of the line and get the individuals who are high risk of severe outcomes vaccinated. We spoke about some numbers, but I just want to add some. 80% of OPD services are in the private sector. 80% of doctors are in the private sector. 60% of hospitals are in the private sector. 70% of households in urban areas and 60% of households in rural areas depend on the private sector as their primary source of healthcare. We discussed the numbers of the vaccination, but we need to do about more than 100 million doses per month. That's over 3 million doses per day. And we have to keep in mind, the immunity doesn't set in as soon as you give the first dose. It takes a few weeks to develop. So we're talking about cases being low right now. We're already starting to see an upward trend in some places. And we can't wait to be in the middle of another surge before we start scaling. We need to scale now, because Covishield, the vaccine that's our backbone, it takes time for the full protection to develop after the first dose. And when we talk about, can government do this? Of course not. It's not only that the government can't do it, but it's also the duty of the private sector to be involved at this time. We have to work together.
What do you think the hesitation is? What do you think the hesitation is? Why is this not happening? Now, one of the technical reasons given by the health minister is that the approvals are emergency use only, and therefore the private sector can't actually be involved. How do you see that statement?
No, what that means is that the government can purchase the vaccines, not that the private sector can't be involved. So the government will still purchase the vaccines and then distribute them. There's no question about this. We need to privatize a part of vaccine distribution while ensuring it is free for the person who needs the vaccine at the point of care. So we need to do both of those things, and the government needs to work on that. But we're not talking about the other thing. If the government tries to take the onus of this, what happens to the people who need other healthcare services through public health? What happens to childhood immunization programs? There's a huge health opportunity cost with the government trying to do this on their own. So we have to involve the private sector, otherwise other health services get compromised.
Okay, Vineeta, how do you see this debate? The thing is that it seems to me that there is an inevitability to involving the private sector. In which case, why are we wasting time? What are we in fact waiting for?
Have an option.
Yeah,
I'm sorry. I agree that we don't have an option but to involve private sector, but I'm saying that this with a sad note rather than a very enthusiastic note, because I think over the years, not just in the recent past, but over the years, we have sidelined and underfunded public healthcare system so much that in the situation of pandemic, we don't have wherewithal to get the public healthcare system going. So there is an urgency for vaccination for a variety of reasons. One is that people were really in panic situation. The second is that healthcare workers and others who are coming in contact with many people on any particular day do need some kind of protection. And also, if there is large scale vaccination done, I'm hoping that the variants causing major chaos will be somewhat reduced. So there is an urgent need for the vaccine to reach as many people as possible. And I am what Dr. Gagandeep Kang had said it somewhere based on the WHO report, and I am supporting that we don't have to worry about 4 weeks as real cutoff for a booster. If we can move it to say 6 weeks, 8 weeks, I still understand planning is required. But even going up to 10 weeks or 12 weeks is something that is okay in my judgment, so that we can actually spread the available vaccines to larger number of people. And I think that is needed. And that is why as others were also saying, that yes, let the government buy the vaccine and let private and public sector distribute it at whatever. Okay. So the recipients do not have to shell out money for the vaccine, at least in the near future.
So would that be an acceptable model, Harsh, very quickly, before I actually come to this problem that we have in our country of vaccine hesitancy, and that needs to be discussed separately, and also that we have blocked vaccines like Pfizer. Would that model be acceptable to the private sector, where the private sector is merely a distribution mechanism? And I ask this because when it came to the RT-PCR test, the private players did go to court on the issue of costing.
See, here costing really is not so much of an issue, Barkha, because the infrastructure already exists. We have people whom we'll need to train a little bit, and that training is ongoing in the private sector to be able to give an intramuscular injection and then to be able to watch for half an hour for any side effects. The RT-PCR test was a different kettle of fish, where equipments were bought, people had to be trained to a high level. And also do remember that in the beginning, the testing kits were not available, and those that were available were atrociously priced. And in fact, it is the ICMR that has always set the rates from 4,500 to begin with, then 2,400, after which all hell broke loose when the states starting, giving any kind of pricing, which had nothing to do, really with the cost of the test. As low as 400 rupees, it's just not possible. Here, I don't see that, because number one, we already have the infrastructure. And this is in tier 1, tier 2, tier 3, even in tier 4. And the private sector is also willing to lend the government a hand for the rural areas. And we have no problem with the government buying the vaccine, and giving it to us in emergency use authorization. In any case, it cannot be sold in the open market. And it may be some time before it actually overcomes that emergency use hurdle. So what we are saying, and we do realize this is our duty to the country. I mean, the private sector always gets vilified, but do remember that is the private sector that took you from a few hundred tests to a few thousand, and then to multiple lakhs. And And now, when the testing numbers have gone down, we are left with those machines, with the infrastructure, and we've spent that money, but we are not crying. But what we say is, do the costing properly. And here, if it costs, see, the government, I think, has calculated, and that it costs about 700 rupees to administer 2 doses of the vaccine. That's why for 50 crore people, 35,000 crores has been set aside in the union budget. And so if it costs 100, 200 rupees, and if we can actually in one hospital immunize 1,000 instead of 100, that is generally getting done per day, we would be able to reach the numbers very quickly and let the government control everything. We have no problem. Let them control the vaccine, let them control the kind of vaccine they give us, let them control even the number of people that we can vaccinate. And the COVID app, we will follow the COVID app and see that nothing gets wasted, because someone who may not be on the line on a particular day, we will already inform people that you may be waiting, and if half the people don't turn up, we will immunize you first. And just as there's vaccine hesitancy, on the other side, there's also a lot of enthusiasm amongst the community for getting vaccinated. I mean, we are in such a wonderful position as a country where countries are coming to us and wanting vaccine. And here, somehow at times one fails to understand why people, especially the healthcare workers, are hesitant to come in. The other thing, the second dose and 43%, and Dr. Bal actually alluded to that, there is confusion right now because there is data suggesting that if you take the second dose 8 to 12 weeks down the line rather than 4 weeks down the line, the efficacy may be higher. And that's one other reason why healthcare workers especially are just waiting, because they are aware of this data. And they hope that, okay, I'll get it at 8 weeks or 12 weeks, and I may develop a better immunity than if I were to get it at 4 weeks. This is also something I think for the government to clarify once and for all, so that it's not that, I wanted to get it at 8 weeks and now my turn is gone and I won't get the second dose. That should not happen.
So let me just get Professor Chauhan in. Do you think, sir, that for frontline health workers, at least, the vaccine should be mandatory? And I ask this because, while in principle taking a vaccine is a voluntary decision, what is the template we are setting? If our health workers, if doctors are going to decline taking the vaccine, how do you create vaccine confidence? That's the first question. Because people will start thinking it's unsafe, there will be fear mongering, there will be rumor mongering. Secondly, given that health workers continue to have the first access to the vaccine, unless the government releases these vaccines into the second category of people or into some sort of open access space, we're actually wasting vaccines. We are wasting vaccines.
So let me just very quickly wrap up the discussion so far. It would appear from all four of us what we are saying, the private sector is willing to help. It is their social responsibility. They are willing to follow any guidelines. So I think we should just get on with this business and then get clarity on this. Everybody is saying with the so-called private sector, you cannot achieve immunization. Fair enough. I would only just add very quickly, private sector is also heterogeneous and one has to keep an eye on this. So there is enough good quality private sector, and I think one should make distinction where the immunization can be done in private sector, period. The question that you asked whether it should be made mandatory. In fact, this question is beginning to come up not so much with the health worker, but it's beginning to come up in US and in France and elsewhere. For the companies, for example, if I work in a company where I deal with a lot of people or work in a mall, I could be asked to vaccinate myself because I meet a lot of people. Same argument could be for the health worker, because they themselves, of course, will be protected, but they will be protected many others. We've always said so far everywhere it's a voluntary exercise and we should impress on people vaccine is a good thing. Without the vaccine, there's very little chance of getting herd immunity in time and so on. How have we failed in this? Very hard to tell. But vaccine hesitancy is in France. Vaccine hesitancy is in US right now. Not turning up for the second dose is also not unknown in the countries which have started vaccination. First of all, I think we just need to make social scientists have to walk in. I think the space is left for social scientists and people, society, and NGOs, that you need to vaccinate yourself. Your neighbor has to vaccinate himself. You have to keep pressing on that. Now, answering your question directly, can it be mandatory? I suppose you could do so in government sector. Many things in the government, like for example, you want to travel, you can make it mandatory. You can't board a flight unless you've taken a vaccine. Those things are easy to do, and I guess this will be under discussion very soon if people don't.
Swapnil, here's the point, right? On the one hand, you have the declining COVID fatalities in India. In the capital where I am, there's been 0 deaths now for more than a couple of days, right? You have some states, including yours, Maharashtra, that continue to show some spikes, but more or less, we are that extraordinary country where our number of cases are probably way higher, and those estimates have ranged from 30 to 90 times higher than have officially been reported. And the Sero service bear that out. But the fatalities are really low. The IFR is really low compared to the rest of the world. Now, what this is going to do is going to make a number of people believe we don't need the vaccine. Kya zarurat hai hame vaccine ki? Herd immunity will come before the vaccine comes. This is how people talk. How are we going to get around that? That's the first question. And secondly, why have we made it difficult for a Pfizer to enter India, and should we have?
So just to contextualize, about the IFR. So it's not appropriate to compare the IFR of one country to another, which may have a different age structure. So we have to recognize that about 40% of India's population is below 18. Our average age is 26 years. Only 6% of our population is above 65. So the IFR at 20 on, if you look at the median IFR at 20, it's somewhere about 0.01% at 25. So we have to contextualize that our IFR, although low compared to other countries, when you stratify by age, it may not be. Then there are issues about whether we are recording all the mortalities appropriately, correctly, accurately. So I think the IFR might be a little higher than we think it is. It's very difficult early in a pandemic to know that.
This is not early in the pandemic. It's been a year.
Well, early in a infectious diseases natural history in a population. I correct myself. So what we need to communicate to people is that it's not just all about mortalities. Of course, mortalities and severe outcomes is one part of it. But we see that anywhere from 5 to 30% of people have persistent symptoms. Their quality of life deteriorates. And more than just the self-interest of protecting yourself, it's building up population immunity and getting our country back, exiting the pandemic. So we need to communicate that. One is the self-interest and then the larger interest. In terms of, I think if we try to make it mandatory, it'll go exactly the opposite way. Like I love vaccines. I would love to take, most vaccines. But the second someone tells me you have to, I'll be like, yeah, not happening. So I think we need to be really mindful of that. We need to convince people. We need to persuade people that it's in their best interest. We shouldn't take a heavy-handed approach. But the second question about letting companies like Pfizer in, well, I think the ship has kind of sailed on that right now. Other countries have snapped up whatever demand there was. The Pfizer vaccine, probably not the best bet for India considering the storage requirements. And let's not forget, India does have mRNA vaccines in play. Genova is working on an mRNA vaccine. Pfizer never did a bridging trial here. And then we have high efficacy vaccines. We have Covovax coming up in India. So maybe instead of thinking about Pfizer, we should just look to accelerate Covovax, Novavax's candidate, which is being produced in India, which is temperature stable, which a post hoc analysis suggested its efficacy against the original coronavirus strain was actually higher than Pfizer's. So maybe that's the right vaccine for India. Just to clarify, I'm not suggesting people should wait for Covovax. Take what you can get your hands on right now. It does not preclude you from a more efficacious vaccine.
Okay, Chauhan, briefly, I will need to go to Vineeta. Yeah.
The Pfizer business, Pfizer and Moderna, these vaccines, of course, do not travel very well. They need special condition travel. But I think people should realize the Pfizer, even if you wanted to buy it today, are oversubscribed. They have no. You can see what happened with the EU purchase of Pfizer and Moderna recently. They couldn't supply to what they've already paid for. So I don't think that question is of much importance, and this much more expensive, by the way, many times more expensive than Covishield or what is available in the country.
Yeah, but Vineeta, there has been some suggestion that those who can pay for it or pay for, it's a little bit like healthcare. It shouldn't be like that, but that's the reality. Those who can pay for a separate room in a private hospital will. Those who need to be in a general ward will, and so down the chain. That's the reality of it. And some would argue, why should the wealthy be subsidized by the government in any case, right? At this point, why should those who can afford to pay for their vaccine be paying for it at all? How do you see the ethical dimensions of this debate? And more worryingly for me, and here I disagree with Swapnil, I do believe, and I could be wrong, and I'm not a doctor, but I'm a reporter who spent 1 year reporting COVID. I do believe we've turned the corner on COVID. I do believe we have. But vaccine is linked to the opening up of the economy, and that is almost as critical as getting past COVID. We need these vaccines to get back our lives. And so if we do not meet these targets, we're not going to get back the lives we had, right? So go ahead, Vineeta.
So should vaccines be available for a price across the counter, I should say, at chemists or private hospitals or so on? I think not today, because my worry is that the government has committed itself to certain amount of money, certain amount of vaccine doses, and the priorities have been set in place. I think that basic priority, at least, I'm not necessarily saying this government has money for above 50, everybody who is comorbid and so on. I think those were ambitious plans, but healthcare workers, other frontline workers, and I also was thinking essentially people in the service sector, somebody like a vegetable vendor who every day interacts with 15 people or maybe 50 people is completely out of this. And that vegetable vendor is also of the poor person kind. So those are the issues which are important. And I do think that this pandemic has already pushed so many people out of the job. Those who were supposedly middle class or at least lower middle class have also been pushed down because of illness, because of loss of jobs, whatever else. So there needs to be a definition of people who cannot afford it, who could not afford it even earlier, but cannot afford it because of the consequences of this horrible pandemic and the lockdown that people face. So those people should definitely be given free vaccine. People like me who can possibly afford it, and so of course we should not be getting those vaccines if we can help it, because then it's the same pot from which everybody is asking for vaccine. And if I get it, I feel I'm depriving somebody who financially is more compromised and hence needs to be supported for free vaccination. Yeah. So the government needs to strategize for this. What I have said is only a couple of things that would matter and those would contribute to the decision making. But yes, eventually the vaccines, and as somebody was saying, mRNA vaccines are very expensive and we will not be able to afford it because of the cold chain. But there will be another 3, 4, 5 vaccines which are likely to get emergency authorization by May, June. So then will there be competition? If there is a competition, then will the prices come down? And probably government's money pot will be empty by then. So we will have to buy vaccines and get it from whichever source there is my guess. My personal estimate is it's by August or September that I think I'm going to find a vaccine which I can buy and get it. Until then, we will have to live with this, is my guess. But I could be completely wrong.
But here's the numbers, and let me start taking last comments from all of you. The numbers look like this, right? We have a little over 9 million Indians who've been inoculated, but we have 150 days to vaccinate about a little over 240 million people. So you actually need, this is the 15th February data, it's moved on a little bit since then, you actually need 2 million vaccinations a day. How can we get to this without the mass machinery of both the private sector and the government sector? I think that's the point. Swapnil, go ahead. Look, make sense of these numbers on your screen.
Yeah, those numbers are bang on. I think we actually need to vaccinate a little more than that. But here's the other issue also that we're forgetting. We're talking about the government procuring vaccines, the manufacturers, those who are manufacturing vaccines, they have built out capacity to distribute X number of vaccines. They've built that out assuming that the government is going to buy that. If the government doesn't start procuring those, they don't have an incentive to scale up. So Serum doesn't have an incentive to go from 50 million doses per month to 100 million doses per month. And while we all hope that the worst of the pandemic is behind us, things can change on a dime, and we can't start scaling up manufacturing at that point. So I think the government needs to start procuring the vaccinations. I think we need to privatize a part of distribution while ensuring it's free at the point of care for those who need it.
Where is the hesitation? What the part of this story that is not clear to me is, where is the hesitation? Are you all able to make sense of that? Swapnil, quickly to you, and then I'll go around the panel.
There's only one thing I can think about. There's regretting the bit of blowback they got after the restricted EUA in clinical trial mode for Bharat Biotech Covaxin. And maybe they're just waiting for the phase 3 data to come out now before they allow it to open up to the private sector.
Vineeta, do you agree with that? Is that why you're smiling?
No, I'm not sure, but I think the hesitancy was certainly because were more often encountered in the healthcare sector workers for Covaxin and less for Covishield. At least those were the early reports, and that is why I was saying. But if I may, I wanted to address another question which probably didn't get addressed. The apprehension is saying, why should I take the vaccine because COVID is going down, is not justified, because none of the vaccines available today stop transmission. And what is happening is that if I have COVID virus and I'm spitting it out or whatever, throwing it out, the other person will also get it. There will be some low level of infection. There may not be disease. But during that phase, again, the spread is likely to happen. So none of the vaccines today are providing us protection from transmission. Until that kind of vaccine is available, we do need to tell everybody that, of course, even if we take vaccine or whatever, we will have some infection, and during that stage, I'm equally capable of transmitting it to others. So it is
just
from
to make
public
it simply,
interest.
it will make me not, I mean, I won't have the disease, but I can still be a carrier, is basically
And
what it means.
it's a public interest also, I think, that I need to take a vaccine so that I don't spread it to others.
Swapnil, you're disagreeing with that, or you're agreeing with that?
I'm disagreeing with that. We don't have data. We don't have data that the vaccines block transmission right now. That's very different from saying that they don't block transmission. So I think we need to be careful. No, I think we haven't really studied this. The trials weren't geared to find this out. Pfizer, Moderna, Novavax, they're all starting to look at this right now. So I think we need to be careful with how we phrase this. It can actually create vaccine hesitancy if we tell people you can still be a carrier. We don't know.
I'm not talking about carrier. I'm sorry. I'm not saying carrier has a different meaning. And here I'm an immunologist and I'm saying carrier has a different meaning. I'm sure Professor Chauhan would agree. I'm saying that the initial phase of infection and the spread, the increase in the virus numbers would be lower if I'm vaccinated. But at the same time, those numbers might be enough if I sneeze on anybody to for the other person to get it, if that other person is also, more vulnerable, comorbid, this, that, and the other. So that is why I was saying it's my responsibility not to spread it. And I will, while there are no data, the transmission blocking is required. For that, you do need IgA antibodies. This is going a bit jargon-wise, but those data are not available. So in that sense, what I'm saying is quite sound.
Let me take it to Professor Chauhan. I think there is, I think what I'm understanding is that you need to be vaccinated even if you think you don't need it, for the sake of the larger sense of security among people. And I think what Swapnil is saying is, if people start thinking ki vaccine ke baad bhi I can still spread it, mujhe mask pehenna padega, to kya fayda in that it would increase vaccine hesitancy. But the science is what it is. What is the science? Vineeta has put forth her argument. Professor Chauhan, go ahead.
So three very quick independent answers, but I'm raising three different questions, very quick answer. I think Vineeta is absolutely right. I think there's data. The initial data came from monkeys. When monkeys were immunized, we found in their throat, in their nose, there was sufficient amount of virus. The load is definitely reduced. She is absolutely right. The chances of your transmitting after being immunized with vaccine are less, lower. This data is beginning to come out. It's not being studied. It's already beginning to be out. But then you don't start transmitting. Now, what if audience listen to, what does it mean to audience? If I get vaccinated, would I transmit or not? Only answer is the chances that you transmit are reduced. Your load will be less, but yes, you can transmit. Is that the reason sufficient enough for you not to be vaccinated? I think that's a very lousy reason. But you would certainly remember, all of us on this panel should remember, the vaccine producers have only promised you that you would be protected from severe, moderate to severe disease and not go into hospitalization. Nobody said that you won't get infected. So keep that in mind. The other is the position with the vaccines, and individual vaccine is changing by the day. For example, South Africa has stopped immunization with AstraZeneca only 2 weeks back. They found their mutant is only 22 to 23% protective, so they've halted their immunization with AstraZeneca. Somebody said new vaccines will come out in 4 or 5 months. Just spare a thought for any phase 3 trial in a country like India, where transmission rates are low, are going to be almost impossible. So because there's no transmission, how do you do a phase 3 trial? Only yesterday, Imperial College has announced that in England, they would start what is called human challenge experiment. We do that for malaria routinely, we do for other diseases. So those things have to come in very, very quickly. Finally, AstraZeneca has already started making a booster dose of the variant, which is from South Africa. So can you mix and match? The mixing and matching of vaccine is a reality. Yeah. And we know, Vineeta will bear me out, we do prime and boost heterologous for HIV experimental vaccine, for Ebola all the time. So I think it will change very, very quickly. But the question centrally, how do you get convinced? Lastly, what confuses people, educated people especially, that when ICMR or I or anybody does a research and says seropositivity in Delhi is 60%. So if you say seropositivity 60% in a larger sample, then you say, my God, we are already very close to herd immunity. Let another 10% get immunized. Why should I offer
But by the way, it's a valid question. Yeah, it's a valid question. I mean, it is a genuine question that people have, that maybe we've already, turned the bend on this.
Yeah, so my question is, I've been looking at this very carefully. What is the test you've done? How good is the test? Where it is tested? Is the data good enough? If it is so, then it should be done in Karnataka, Bangalore, Chennai, everywhere. If half of the country, more than half country is immunized by natural exposure, which is a damn good immunity to my mind, I could argue really successfully that might even be better than the immunization. Then naturally people would say, why bother?
So what's the answer to that? I want to quickly wrap up with Harsh. What's the answer to that?
I would say, even if seropositivity is this, we don't know how long your seropositivity is going to last. Please go and get immunized. And I think this should be hammered on daily basis. But, you can only hammer. Remember, finally, hesitancy is everywhere. America is struggling with immunizing 1 million. Biden has promised the country 1 million per day. We are talking about 1.4 million per day. And welcome to open arm, welcome to private sector helping the immunization. I still think that getting the numbers that we put ourselves against is going to be difficult, but if it happens, it will be very impressive indeed.
Okay. Harsh, closing comment. I mean, we're gifting vaccines to 13 countries. It's quite a proud moment as a country, but we can't get our own people to sign up for this vaccine. It is a complete irony.
No, ultimately, I'm sure they will. But even on the seropositivity, we don't know how the sample collection has been done and how much of bias is there. That's number one. So that 50-60% may not be, and is most likely not what it seems to be. Now, you asked a question about why is the government hesitant in involving the private sector. I would say that it's a dynamic situation. We are still very early on in the vaccination drive. and the government will get the private sector in for delivery. And the private sector has been very open-ended about how the government may choose to use its services, and at no profit, no loss basis. Second, I think one of the hesitancy also is from the manufacturing capabilities on a per month basis of the vaccine manufacturers, and whether if we immunize too many people too fast, whether we will end up with a shortage later on.
But right now it's the opposite. Right now you have vials that are being opened that aren't being fully used. No, Veer, that's not true.
Also, I think the government has now allowed anyone to walk in. You have to be in the list. If you are, you will get immunized. And thirdly, I think the factor why I personally feel those who can afford it should be made to pay for it. But the government has this hesitancy, ethical, moral hesitancy, that if the rich are able to actually jump the queue and come in front, that would not be right. So I would say when the rich get their turn in the list, they should pay for it. And those who cannot afford it should get it free. I think that most of us who can afford it would be willing to do that.
I think we can end on that note of agreement. But the one thing's for sure, we can take some solace from the fact that our fatalities stand low compared to the rest of the world, the fact that we are gifting away vaccines. But please, if you are on that list, take the vaccine. I do not understand, and health workers, we need you to lead by example. You are contributing to this, to the fear mongering among the general public. If you as a health worker do not take whatever vaccine you have access to, I think we can agree on that as well. Leaving it there, Swapnil, Vineeta, Veer and Harsh, pleasure having you on the program. To our audience, thank you for joining. We'll see you tomorrow, same time, same place. Thank you for watching. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.